Welcome to our channel. Today, we're diving into a genetic condition known as Noonan Syndrome. This condition affects many aspects of an individual's physical health and development. Noonan syndrome is often characterized by unique physical features, developmental delays, and an increased risk of certain medical complications. It is caused by mutations in genes that are involved in the ROS-MAPK signaling pathway, and while many different genes can be responsible, mutations in the PTPN11 gene are the most common. Individuals with Noonan syndrome may exhibit distinctive facial features. This can include a broad forehead, widely spaced eyes, a low hairline, and a short neck. Often, the ears may be low-set and more rounded than those of their peers. These physical characteristics can vary widely in appearance and severity from person to person. It's important to note that not everyone with Noonan syndrome will have all these features, as it presents with a spectrum of symptoms. Beyond physical traits, individuals with Noonan syndrome may struggle with certain developmental challenges. These can include speech and language delays, as well as learning difficulties. Early intervention services such as speech therapy, occupational therapy, and educational support can significantly assist these individuals in reaching their full potential. One significant aspect of Noonan syndrome is its connection with congenital heart defects. It is estimated that up to 80% of individuals with this condition may have some form of heart anomaly. The most common heart defects associated with Noonan syndrome include pulmonary valve stenosis, atrial septal defects, and hypertrophic cardiomyopathy. Regular cardiology evaluations are essential for monitoring heart health in those affected. Another important medical concern is the potential for bleeding disorders in individuals with Noonan syndrome, particularly those linked to platelet function. This can sometimes lead to easy bruising or increased bleeding risk. Regular checkups and monitoring of blood counts can help manage and identify any issues early on. Growth issues are also common in Noonan syndrome. Many affected individuals might experience short stature, with those growing less than expected compared to their peers. Growth hormone treatment may be an option for some to help reach a more typical height. It is essential for caregivers and healthcare professionals to monitor growth patterns from an early age. Moreover, Noonan syndrome can affect fertility, particularly in males, who may experience issues related to testicular development. Females may have normal fertility, but potential complications should be discussed with healthcare providers. Diagnosis of Noonan syndrome typically involves a thorough clinical evaluation, which includes assessing physical features, medical history, and often genetic testing to identify specific gene mutations. Early diagnosis allows for timely interventions and support therapies, which can greatly enhance quality of life. Living with Noonan syndrome requires ongoing support and management of the various symptoms and health issues associated with the condition. Pediatricians, geneticists, cardiologists, and various therapists often work together as a team to create a comprehensive care plan that addresses the individual's unique needs. Support groups and resources for families can be incredibly beneficial. Connecting with others who understand the challenges of Noonan syndrome can provide emotional support and practical advice. Organizations dedicated to genetic disorders can also offer information, resources, and advocacy to help families navigate the healthcare system. As we conclude, remember that each person with Noonan syndrome is unique, and while challenges exist, many lead fulfilling and productive lives. Advances in research continue to improve our understanding and management of genetic conditions like Noonan syndrome. If you or someone you know is affected, don't hesitate to reach out to healthcare professionals for guidance and support. Thank you for joining us today to learn about Noonan syndrome. If you found this video informative, please give us a thumbs up and subscribe for more educational content. Your engagement helps us reach more people and spread awareness about important health topics. Until next time, take care.